Good evening, everybody. Thank you so much for coming to our webinar this evening. My name is Alec Chakowski. I am the Senior Executive Director of Alice Health Promotion. And welcome to the Nicotine Awareness and Help Town Hall. Next slide, please.
We'll give a second to let folks come
Oh,
in. Welcome, everyone. And then thank you for coming for today's town hall. I'll do next slide.
thank you so much. So before we get started, going to give folks a chance to introduce themselves. So I will start with Jackie because she is the person right next to me.
Hi, everyone. My name is Jacqueline Hawkins. I also go by Jackie. I am the Director of Direct Services for Alice Health Promotion. And I'm also someone that uh, does substance use recovery work. With that, I'm trained as a tobacco treatment specialist, and I'll stop with that there.
Michael?
Thank you. My name is Michael McNeil. I am the Associate Vice President for Administration and Chief of Staff for Columbia Health. I also have a faculty appointment in the Mailman School of Public Health and Sociomedical Sciences, and I did my nicotine dependence treatment at the Mayo Clinic.
Rocco?
Hi, everyone. My name is Rocco. I use they/any pronouns. And I am a health promotion specialist with Alice. I also work in the substance use and recovery portfolio. I'm somebody who's also trained to be a tobacco treatment specialist, as well as supporting students on any conversation related to substance use and recovery.
And Taylor, would you like to introduce yourself?
Hi, everyone. I'm a graduate student at Teachers College and the Nicotine Awareness and Help Project Coordinator or College Leader, depending on which title you use.
Thank you so much. So quick overview of today's town hall. We're going to talk a little bit about the partnership we have with the Truth Initiative, a little bit about what nicotine awareness and help, better known as NA, is, our current and possible ideas for future policies, and then leave time for you all to ask questions, make comments, share any concerns you have. At that time or throughout this, you can ask questions in the Ask Feature button located at the bottom of your Zoom screen. But we'll also have a chance for folks to verbally ask questions later on in this webinar if you just use your raise hand function. Next slide, please. Oh, and there is all of us. Go ahead. And I will pass it on to Jackie.
All right, folks. So what we wanted to do is just give you all some contextualization. I know for me, I've been at Columbia since 2018 and have been able to hear this from our affiliates. And when we say affiliates and we're talking about the impacts of nicotine, both smoking, vaping, just usage, you'll notice that we're talking about not only HIPAA compliant one-to-one meetings that we have with folks through that tobacco treatment lens, but also at the community level in the work that we do with our responsible community at Columbia work. That's just our overall substance use recovery work at that community level. So we've kind of listed a few out here for you all that have been the most often brought up concerns and or topics from the various Columbia affiliates. So we've heard people talk with us around, the struggles of entering and exiting buildings and then having to walk through smoke or those designated smoking zones. We specifically have seen it various times shared about people vaping or smoking often vaping within special collections libraries, private spaces, and along with that, not only in these spaces, also in their residential communities, that exposure to secondhand smoke. And then with the last two bullets here that we're kind of highlighting for you all is those social norms piece around understanding nicotine and its impacts. We've had very many folks come to us explaining that with the normalization of vaping, they didn't know that it was going to have these addictive aspects to it, or they thought it was just another party drug, that there wouldn't be a develop of dependence there. And so that motivation piece, lastly, is around Also, people saying, oh, I didn't realize that this was going to be as available in these spaces. And so we wanted to contextualize all of these conversations that we've been hearing from our community to then bring you all into the conversation of how we get to the work that we're doing with truth. So next slide, please, Rocco. And so, knowing that context about Colombia, and specifically with Rocco and I doing that tobacco treatment work, we heard about this opportunity to collaborate with the Truth Initiative. And so, the Truth Initiative is an organization that focuses on working towards that goal of creating environments, specifically within the college arena for this project, that are smoke or vape free. The purpose of this is to have us look at our policies, look at what our students are saying and what the community's saying to really assess what's going to be the best outcome for our various affiliates. Additionally, we're one of the 10 schools that were selected to receive the grant this year, which is both really exciting and gives us some time to talk through what might be the best options for us at our institution. And I'm going to spare you some details now because later on in the presentation, we'll go over a timeline of what that may look like.
So with the Truth Initiative and the grant, one of the initiatives that we launched was the Nicotine Awareness and Help project, which is also known as NA. NA is meant to be not only a subset of responsible community at Columbia, which is to encourage safe, smart, responsible substance use, but also meant to be a social norms piece around folks being okay with the idea of saying no to smoking and really encouraging for folks who are quitting smoking to be able to say no as they go through the quit journey. Like Jackie mentioned and Michael mentioned, the three of us have, I think all of us on the call have done some sort of tobacco treatment program. And I'm one of the current providers that oversees nicotine cessation. So one of the facets of NA is really encouraging not just the one-to-one conversations, but also continuing up to the community norms around smoking and vaping on campus. So some facets of this initiative also include nicotine cessation, which is the program that we run through Columbia Health. This is a program that's encouraging students to navigate their relationship with nicotine. If they're quitting nicotine, what is getting connected to different things like quit smoking medication, behavioral strategies for quitting, etc. It is meant to be for any type of nicotine. So we might have heard like tobacco cessation before or cigarette smoking or quitting cigarettes, but it's meant to be for anybody who's quitting smoking, vaping, Zyn, and nicotine pouches and things like that. It's intended to be encompassing of all of those different types. This semester, we also launched a group version of nicotine cessation. It's called a super group. Super is substance use prevention, education, and recovery. And it's a part of our group wellness coaching initiative. So this is something that hasn't happened on Columbia's campus before, where we had like a group of students who were navigating the quit journey together. So that's something that's really exciting. We're hoping to do it, to continue it after the semester as well. But it's a group that is launched and is meant to be more the social support aspect of students meeting other students who are also quitting and being able to go through that journey together. Another exciting thing is that we installed a vape disposal bin on John Jay Hall, third floor. There's a picture of it to the right here. You can't really miss it. It's pink. And we're really excited for this because one of the conversations that were coming up was how do you dispose of vapes knowing that nicotine itself is a hazardous chemical to the environment, as well as the batteries in many vapes, because they're lithium, they can be really hazardous to the environment. So this now gives students the opportunity to have safe vape disposal and put them in a place where it can be a little bit more environmentally conscious. This was really exciting because the nearest vape disposal bin was not as accessible to campus. I think it was down on like 96th Street. So now that it's happening on campus, it's really exciting because students are getting to throw away their vapes in a way that still encourages to think about more of the environmental impacts of vaping. We also updated questions on Go Ask Alice, which is our health Q&A site. Definitely giving a shout out there because they got a facelift recently, as well as they recently won an award. So I really recommend y'all checking it out. We have different fact sheets on nicotine, as well as how to navigate the quit journey and what does withdrawal symptoms look like. And then I mentioned education and awareness campaign on nicotine. That's what NOT is meant to be. So it's getting at the social norms piece around nicotine, as well as encouraging folks to not only consider their relationship with nicotine, but if you're quitting, being able to say no, someone offers you a cigarette, or is as you're navigating the cravings related to nicotine. Additionally, as a part of the grant, we really wanted student engagement. So we hired 2 nicotine awareness and help project coordinators. Taylor on the call is one of those. She is the graduate project coordinator. Then we have 1 undergraduate project coordinator who unfortunately couldn't be here tonight, but he is somebody that's been involved in our work. And lastly, we wanted to gather feedback from the community about the current and proposed policy changes. So what this town hall is, we're encouraging folks to give us our feedback, and we'll talk through different ways to give feedback about the proposed policy on some of the later slides.
Great. So let me give you just a little bit of contextual sort of why are we doing this now? Sort of what have we done before? Just to sort of set the stage for the further conversation. So it's been over a decade since the university last looked at the policy for specifically for Morningside and now the Manhattanville campus. And a lot has happened, both at the institution, but also in the world of nicotine delivery devices. So e-cigarettes, vapes, other products that are a bit more commonplace today didn't exist when the last policy was created. Vaping was a technical concept in the previous version, but it really wasn't a mainstream piece. And the policy, when it was updated, was inclusive of concepts like e-cigarettes and vapes, even though they weren't sort of widely understood or known in terms of the way we might know them today. The national movement on this has also shifted, and we're seeing more and more campuses who are adopting sort of a nicotine-free environment. So nicotine in all its forms, that's the smokable forms, the vaping, the smokeless tobacco or similar products. As a sort of broader university community, we actually don't have complete alignment in our policies, right? So the sort of the rules at Barnard, the rules at TC, the rules at the Medical Center campus are not quite the same as the sort of expectations of individuals at Morningside, for example. So there is a little bit of confusion that may exist out there, depending on the sort of, you have to think, where am I right now, and what is allowed or not allowed, and that's not very supportive to our populations in the various spaces, because we're putting it on them to sort of figure out where they are and what the expectations might be as members of our community. And of course, part of that is also because students in particular, although to some degree staff and faculty as well, there's a transience to the population. People may come in sort of not knowing any of this history and also not necessarily being fully provided opportunities to understand the community expectations, policies, et cetera. So next slide. And just a little bit about that current policy for you all tonight. The current expectation of those that want to use these products is that there are designated, they're called smoking areas, but smoking is a term inclusive of vapes and e-cigarettes and other similar devices. Those can only be used in these designated areas on campus. There's two ways to sort of learn about these. On the university's campus maps page, there is a map of the designated areas. And then they're also indicated by receptacle devices. They're about half the height of a standard sort of outdoor trash can. They have a light blue band around the top of them for those that can see the colors. And they do have some labeled language on them, although if we're being completely honest here, people aren't necessarily reading what is in those spots. And they were strategically located to provide both opportunity for those that wanted to avail of cigarettes or vapes or other similar devices, but also to provide an opportunity for those that did not want that exposure to have a sort of a knowledge of where it was so that they could plan their routes accordingly. So it was sort of designed to bring these two pieces together. One of the early conversations, last time this was revisited, and in this just a piece I forgot to mention on the previous slide, part of what motivated the timing of this is looking at the programs that we're offering more comprehensively. It's how does policy and expectation of members of our community fit with the services, including the cessation services and others you've heard from my wonderful colleagues. The Columbia approach to this has been one of we want respect in our community, and respect means voluntary compliance, right? It's not designed to be punitive. And the goal is if everyone knows where things can and can't, they can plan accordingly. And that if somebody doesn't know, for example, and I'll give you a very individual example, there's a spot very near where I sit most days on the Morningside campus that people tend to congregate, especially when it's a little colder or wetter outside. But what I found over the years is when I've shared the information on the nearest location, people have been very willing to move, right? It was a lack of knowledge of the designated areas. It wasn't an intentional resistance to the expectation in our community, right? So the idea is every member of our community can just sort of help educate those that may not know, right? We want to actually assume that they may not be familiar with and that it's not an intentional disregard. And very, I think, importantly, on this policy and a number of others at the university, there's a very specific language to prevent retaliation, right? If somebody is asked to comply or is held accountable for a failure to comply, that there wouldn't be retaliation. This is really supposed to be about a respect for each other and a support for the choices that we all might make. So hopefully that gives you a little bit of background on sort of how we got to where we were, and now we can sort of shift to, and where might we go?
So where we can go, one of the options is looking at Columbia becoming a smoke, vape, or nicotine-free campus like other policies at Barnard and COIMC. What this intention would be is that it would remove the designated smoking areas and replace with signage to encourage the smoke, vape, and nicotine-free campus, including non-smokable forms. If you've been to the COIMC campus, some of these signs already exist. You might see them as like respect the air we share, and that type of language. There's a couple different already precedents at the other campuses for a policy like this. Um, because we're in the city, there is a little bit of conversation around what the boundaries are for this. So the boundaries would be within the gates of Columbia's campus, and still maintain that distance from Columbia buildings outside the gates. That's very intentional because the way we exist within campus is that what is considered the Columbia campus within the gates versus what's considered New York City when you leave the gates. So this would be the idea of kind of protecting the environment on campus. So the designated smoking areas, for context, all 14 of those exist within the gates of Columbia right now. So that would be removing those spaces and replacing it with that signage, and then the campus itself would become, in theory, smoke and vape free. The no retaliation clause would also remain. That's something that we want to encourage. As Michael mentioned, this is about respect for one another. We want to encourage, like we mentioned, respect the air we share and being able to support and build that community of care that Columbia Health has really been encouraging. We don't really want a punitive measure from this in terms of the folks getting in trouble and there being punishment, but the intention is to have a culture of respect and a culture of shared community. There are different ways we're gathering feedback for this. So we're using the feedback to write the policy proposal, right? So the reason we're gathering this feedback is so we can have an understanding of what does the campus think about this idea. Knowing that there is precedence at the other campuses, there also is other precedents at other schools in New York City, such as NYU. What does that look like for Columbia to become smoke and vape free? Part of this is forming a task force comprising of students, staff, and faculty. We want to make sure we have a 360-degree perspective on the folks that are interested, whether and bringing those variety of experiences together so we can get a fuller picture about what are the implications of this policy change, what are the areas we're not thinking of that might be even blind spots. That way there's multiple people in the room to provide that knowledge. We're also gathering feedback from the community through surveys and environmental scans. The chat should have surveys for students and employees. There's a separate one for each. For those students, if you fill it out, you can get a NA-branded Hydro Flask. You can get into a raffle to potentially get one. So definitely recommend doing that. But the intention is to get your idea around what would the policy be, what is the current knowledge of the current smoking policy, what should the proposed policy be, and what are the other thoughts for the ways that we navigate nicotine on campus. And the environmental scans we've been doing. There's some interesting feedback from that, right? There's a general idea that folks may not know where the designated smoking areas are. There's not enough signage for it. Another feedback piece is that some of the signage that even talks about no smoking might even be older, or as Michael mentioned, it might not even be in the designated smoking areas. So there's different things that show up as we're doing these environmental scans that students may not know, and that might contribute to the reason why there isn't really an understanding of where you can and can't smoke and vape on campus right now. We're also going to be having our project coordinators conduct focus groups. So they're intended to be undergraduate and graduate focused. So we're getting more of that nuanced perspective and having more of a discussion around what these changes are. And then we're also doing key informant interviews. So those are interviews with different campus partners to get to know how would this change impact them and what are the ways in which we can partner together, whether it's through a task force or understanding the policy changes that would be able to best suit the needs of the campus. So examples, we've done key informant interviews with facilities and operations to get to know what would the changes be operationally with this policy? What would it look like for you to know the areas where you would have to clean up cigarette butts or anything like that. The usage of the cigarette urns that people use around campus and where are they used more often, things like that. We're of course tapping the University Senate. When we propose the policy, it has to go through the University Senate. So we're connecting to the various committees right now, and our intention is to connect with some that are going to especially impact like faculty affairs and student affairs. And then also faculty with related research experience. That's something that we really want to encourage, like folks from the climate school, folks from the Mailman School of Public Health. Those are the different interviews with the campus partners that we're trying to do. And then there's much more than that as well. We have to include like Columbia Human Resources. It would be a really expansive project that would involve multiple different areas. And then, of course, we want students to get involved as well. That's why we have the focus groups. We're definitely open to student feedback. We're tapping different areas that folks can get support from. Like we're going to talk to the Student Health Advisory Committee in November about some of this change as well.
Great. So we've kind of, just to kind of pause where we're at, right? So we've been able to talk about the context at our university, the why now piece, and even what we're thinking. We wanted to be able to show you all this timeline now of what we're working with, if you will. So as you can see, spring of 2024 is when we already had applied and got granted like the green light that we were receiving these funds. And we started putting all of our ducks in a row to get things coordinated. So we hired Taylor and Arthur. We were getting things ready to know that we were going to do it come fall. And with summer, that's where we started looking at our own programmatic needs, right? So Rocco, I want to give major flowers to them of looking at building the infrastructure for better support, not only one-to-one, but at a groups level for tobacco treatment, as well as that vape disposal bin, etc. We were thinking about what services through Columbia Health do we have that is accessible to the student population, as well as basically making sure that we are up to date with what we're offering to folks. And now we're in the present looking at fall 2024, and that's where we're starting to get that information, just like Rocco shared. Additionally, we are working to gather a task force. It's kind of like our own mini Avengers, if you will, good Marvel reference, of all these folks across the community that have these different backgrounds and approaches to this work so we can have as many folks in the room as we're making these decisions. And then, of course, we'll move into 2025 and in spring semester, that's when we're going to continue with that feedback and start thinking about what the policy may look like. We'll finish out with summer and summer into fall of 2025 with actually doing that policy proposal and seeing what makes the most sense given all this contextualized information and feedback that we've gotten from the community.
And to give even further clarity, I want to talk about the benefits and considerations we have when we're talking about a smoke, vape, and nicotine-free campus. There's some big benefits to having this change in policy that both support students who are looking to quit nicotine, as well as folks who might just be exposed to secondhand smoke or even have their own personal desires and values around health and wellness. Some of the benefits include opportunities to educate community members about nicotine and tobacco. As Jackie mentioned at the beginning, that's one of the pieces of context we've been getting from students who might not have an understanding of what is nicotine, or if they're having it at parties, there's not this understanding of what the potential is around dependence with it. And even thinking about the context of we have a large international population, and then not everyone got the education that could be due in school, where it might be like the examples of like the black lungs and like the long-term effects of nicotine. Like there's so many different lived experiences here that some folks may not have gotten that piece. So having an opportunity to educate the community members and really renorm what that relationship with nicotine can look like. And I say relationship intentionally because relationship with the nicotine, it can be not just physical, but it can also be psychological. It can be emotional. It can be all these different components and these different nuances. There's also economic and environmental benefits to this change, and it would align with the plan for 2030 around around some of those economic and environmental changes. We mentioned the vape disposal bin, right? Like part of the impacts of improper disposal of vapes is that there is this culture of consumerism, with it, especially with disposable vapes, and nicotine being a hazardous substance to the environment. So having folks who are encouraged not only to educate themselves on nicotine, but also reduce their consumption can also reduce some of the environmental impacts that the nicotine industry has contributed. There's also a conversation that changing this policy actually encourages folks to not only reduce tobacco and nicotine, but it also supports quit rates among folks who are quitting. I meet with students who are quitting, and there's been conversation about how going smoke, vape, and nicotine free would actually help them, because one of the strategies around quitting is going to places where you typically aren't allowed to smoke. Sometimes it looks like going to cafes or going to places that you know are smoke free, and that encourages you to maintain that throughout the day. So having Columbia become like that could also encourage folks to really reduce. Think like if they go to the libraries or they go onto campus and it's a place that they can go and they don't have to there might not be that conversation about, oh, should I smoke here, should I not, because the policy's in place. Would also reduce secondhand smoke and vapor exposure on campus. That's something we get especially from students talking about things like College Walk or in and out of buildings, as Jackie mentioned. And this policy would mirror the policy to other campuses and institutions, not just at Columbia. So Harvard, University of Pennsylvania, NYU, CUNY, all these different places that have already these policies in place. As Michael mentioned, there's been this movement across the nationally to make some of these changes. We do want to give some considerations as well. There are, as a best practice with these policies, there are exceptions to those rules, including using nicotine for research and the use of sacred tobacco. Those are considered exceptions because they're not associated with the commercialized tobacco and the dependency and addiction rates that come with using nicotine. We're also considering different areas around campus, like College Walk as a walkthrough for many non-Columbia affiliates, / if folks were to move off campus, where would they end up going to smoke? Would it be in the streets around Columbia and things like that? And then we also think through enforcement, education and resource focus rather than a punitive approach. I run Basics, which is a substance use screening and intervention program. Something like that could also be an outcome for somebody where it's more focused on the education aspect of nicotine and kind of that respect the air we share mentality of having that shared culture of respect and care for one another. Also wanted to give a shout out to some resources. Shout out to Alec, who's been putting them in the chat. But there's a different resource at the Truth Initiative. I recommend checking out their website. They have a plethora of information on this topic. We also included cessation resources. We talked a lot about cessation for students. We also want to talk about cessation for staff, faculty, and non-affiliates as well, because this town hall is technically open to the Columbia neighbors. So folks who are not affiliated with Columbia but might be living in the buildings around the school. So if folks were interested in quitting, NYC Quits is a great resource. You can actually get short-term free nicotine replacement therapy through the state. So definitely recommend checking them out. And also NY Smoke Free, another great resource as well. There's a lot of New York City and New York State specific resources. And then for Columbia, the students have access to the nicotine cessation program through Columbia Health. Barnard students can go to primary care health services and the ASAP program on their campus. Staff and faculty can go through their health insurance or the Columbia EAP program to get support for nicotine cessation. Truth Initiative also has a This Is Quitting line, which is a program that helps folks encourage folks to quit, as well as become an X through the Mayo Clinic. Those are also great resources as well. And then non-Columbia affiliates can use some of those same things that I just mentioned, as well as calling 311 or NYC Quits for support. And now we want to pass it to you all. So we've gone through a lot of the background around what this project is. We've given you kind of the TLDR, if you will, of all the different aspects to this work and what our plan is for the next academic year. So we're hoping to hear from you what your questions, comments, concerns are around this topic. And please feel free to use the Q&A feature to ask any questions.
You can also use the raise hand function if you would like to talk. Give folks a couple moments if they're typing. think one of the questions while we're waiting is that we have seen and have come up in several of the conversations that we've been having is obviously this is focused on the conversation tonight has been focused on nicotine products, but one of the questions that we've gotten multiple times is around, well, does this also include other smokable things that you can do through either vapes or other smokable products. So I will put that out to the panel, or I'm happy to answer that as well.
I can answer that. Or Michael, I saw you on mute if you want to answer it.
Sure, I'm happy to jump in and help out. So, as a higher education institution, there are certain federal pieces that we have to stay attuned to. And at the moment, the federal government does not permit the use of really other, and let's just be very transparent here. The most frequently cited one is marijuana, right? That's what people tend to bring up as the example here. And right now, federal law would not allow that to occur in an educational environment, right? Even though the states have decriminalized or legalized in a variety of ways around the country, as an educational institution, we're still bound by the federal requirements. The willingness to enforce this, we will very transparently admit, does vary from administration to administration, but the law itself sort of provides some boundaries around what is or is not allowed, and specifically what is or are not allowed in our policies. There's some very specific federal guidance that we have to comply with as an institution. Now, that doesn't mean we can't do incredible things with our harm reduction work, and you've heard a great deal of examples of that from Rocco and Jackie and Alec already this evening.
Thank you. I will also add the piece around combustion. The intention of this policy is to reduce especially the combustion piece around smoking. And we hear a lot about secondhand smoke and secondhand vapor from vapes. But something we also want to consider is that even if it's something like marijuana, there is still byproducts, especially with THC in that secondhand smoke and vapor that come from those products. So even with even if the policy ends up becoming where marijuana ends up becoming legal right at the federal level, the conversation is still there around the combustion piece, because that's what this policy is really getting at. And it's so common with nicotine, but it would be composed with it would have come up with other smokable products as well, because the combustion can still have both an effect on yourself and the folks around you.
Thank you both. The next question that has come in is there any talk about safety of students leaving campus to smoke?
I can take that first. Or, I see you on mute, Michael.
I mean, I think we all can speak to this, right? Safety of our community is important, and we're talking physical safety, stepping outside, talking about safety of the self and others when using these products. Yes, has it come up? Sure. It always comes up when we have this conversation. Rocco, maybe you could speak a little bit to what you're hearing from people as you do that cessation work as
Yeah.
well.
Yeah. I think one of the conversations when we think about safety is who's impacted by this policy change. And that can include where folks are going to smoke with this policy change. That might include right outside the gates of Columbia. You're still within a certain number of feet from the building, right? But if you're on the New York City street, that looks a little different. So where are folks going, knowing that we have parks on either side that are adjacent to the communities? Are folks going to go into the parks, for example, to go smoke, which is a different conversation when it comes to not only like the environmental impacts, but also the risk of fires and things like that. So we're considering safety, especially when we talk about folks leaving campus. One of the times it comes up especially is at night or in the early morning. If you know anything about the dependency of nicotine, it's strongest in the morning, because that's when the cravings are. It's been at least 8 hours since you've had nicotine, and nicotine is a very quick dependency. It can be very quick, the withdrawal symptoms to show up. So in those early hours in the morning, what does it look like for folks to go off campus and think about that. In that instance as well, you can also think about the fact that it's reducing quit rates because it might be encouraging folks to not even to not leave campus because they have to actually leave their building to go smoke. So part of that is a little bit twofold, right? It might be encouraging folks to reconsider because there have been students that have named like, oh, if I have to leave campus now to go smoke, I'm just going to skip this, and it's encouraging them to reduce their nicotine use. The Part of our work is also going to be involving folks like public safety in this conversation about what does it mean for students to go off campus, more so in the context of students who are coming to and from campus. Like, what does it mean for them to still be in a safe environment? The encouragement of this policy is to say, yes, you can still smoke, you just can't smoke here. And we still want those students to be safe and feel like they can access places where they can smoke if that's something that they choose to do. So that's something that we still want to highlight. This isn't meant to put students at risk, but it's meant to reconsider the idea around like what is their relationship with nicotine and encouraging them to change that relationship, as well as working with different campus partners to ensure that the students still have safe means to go smoke.
And I would love to just reinforce one point too. If we think back to that timeline piece of just this past summer, the folks on this call were actively thinking about what type of, the nerdy way of saying it is like early intervention work that we can do to think about not only the tools to help those folks when they make those decisions, but also that reframing, that extrinsic and intrinsic motivation. So I really want to like tie this with a bow around it of that this process, even from the application phase of applying to truth. We luckily had Michael's wisdom from doing the work the last time, but also with Rocco and I actively hearing it from the community, we've been centering those voices, trying to kind of get ahead of different aspects, at least with the work that Columbia Health offers for folks who do currently use nicotine products and what it might look like to help them transition away from that.
Going to open it back up again. I'm not seeing any questions at the moment, but does anybody else want to pop a question into the Q&A or raise their hand to ask one?
Alec, if you're okay with it, I'd like to offer a question that came up quite extensively the last time Columbia took a look at policies and ideas on
Please.
how we support our community, and that's around the issue of enforcement and sort of conversations that have been happening this go round so far with members of the community on that.
Can speak to some of that. We've certainly got some questions around enforcement as we've been doing our key informant interviews and our focus groups and things like that. I see some of you nodding your heads because you were in those interviews with me. The main conversation around enforcement is the concern around the punitive measures that comes up a lot. So we do want to reiterate that this is intended to be not just a focus on education and resources support, as well as bringing up that culture of respect. But also that this isn't meant to be a gotcha conversation. The intention of this policy change is not for there to be a level of enforcement where folks are having a punitive measure, there's a punishment involved. It's not the intention. Part of when we think about the broader scope of harm reduction, part of that is having educational interventions in that early intervention work to be able to intervene and have folks understand the impacts of the secondhand smoke and nicotine at large. So when we think about enforcement, it's a little bit of a pivot away from that punitive piece and also talking about what does it mean to encourage that compliance piece? What does it mean to encourage that shared responsibility and that shared community aspect? Part of that can look like, as the previous policy mentioned, of folks having a level of community of care where we're all kind of at tasked and responsible with knowing the policy as well as encouraging folks to adhere to it. Part of that is through the signage that we'll have where it's talking about the respect the air we share and thinking about the different norms campaigns and the different ways we can educate the community on the policies. I know we've explored the idea of like during orientation, having a segment dedicated to that. So all incoming students come through, working with human resources, so all incoming employees know about the policy, really focusing on that early intervention and that education work, because the intention is to kind of get at that piece before something like smoking on campus after this policy change would happen. The other question that comes up is I mentioned that piece of like who, so it would be like building that community of care that we're trying to encourage, which is that we're looking out for each other. The intention is, like I mentioned, is not to get folks in trouble. So it's really encouraging folks to be considerate and having that respectful environment towards one another.
Rocco, I figured I'd just tag on to that too. That's something I think that really is helpful, like the two underscoring pieces of what they shared of we're trying to connect this with people's values and thinking about that community level aspect, but also our RC at Sea or responsible community at Columbia perspective has always been non-punitive. It's always been how do you make decisions that are in alignment with your values? How do we make you feel good about the choices you're having around substance use recovery topics? And so it really fits beautifully into the larger conversation that we've been having at Columbia for at least well beyond my time. And also, we are a leader in the Ivy League in terms of really shaping how we have these conversations. So it's pretty interesting that we're one of the few schools that still haven't hasn't switched over to being completely smoke and vapor free. But people have really admired the way that we really center the individual and talk about this through that lens instead of making it a punitive aspect. So we're very committed to that. That's not something that's new with this. That's something that we've been doing historically with our substance use recovery portfolio on campus.
Thank you all. Oh, Rocco, I'm sorry. Were you going to add something?
Jackie's comment made me think of something else, another question similar to this we got, because in one of the key informant interviews, right, one of the questions we got was, well, if there isn't really an enforcement piece, what's the point of the policy change? And I wanted to give kind of a shout out of a policy change is not just the intention of bringing about something to enforce or have some sort of punitive measure with it. Like we said, we're not trying to have a punitive measure, but there's other benefits to this policy change. It can encourage folks to reconsider their relationship with nicotine. It can encourage them to be educated about the exposure to secondhand smoke and secondhand vapor, understanding the economic and environmental impacts of nicotine, and really starting to mirror and being a part of that movement that other colleges and universities have. So this is more than just about a policy change with the intention of, like I said, it's not the intention of getting to a gotcha, but it's really more than just the enforcement conversation. It's also about encouraging folks to center their values that Jackie mentioned.
I think we're volleying at this point because I do think that one thing that we underscore, at least at the work at Alice, right, is folks don't know what they know until they know. And so if we're thinking of the question of how would they have known or thinking about health literacy and making this more accessible, right? You have multiple folks on this call who are providers, if you will, that can do tobacco treatment and support or nicotine treatment and support. But what we're trying to do is not only think about that education paradigm, that values piece, but also actually turning to the community. We've had so many folks that have quit smoking historically and have been excited to join these key informant interviews and to talk with us about from their own experience, like what they witnessed and what they wish the university would have done 15 years ago when they quit. So I think it's also an exciting time for us to nerd out about the data and the insight provided from the community in front of us, because then we can make a really good, well-rounded, almost argument around what's going to best support folks. And I'll stop there, Alec.
Well, at this point, we are not seeing any more questions, so I will go ahead and say next slide. And I think we just all want to thank folks for coming today. We really appreciate you taking time on a Monday evening to spend quality time with us. If you do have feedback for us after the session today, please feel free to email health@columbia.edu with any questions, comments, concerns, and like we said, additional feedback. And we did put in to the link the surveys for students and for employees and community members. And at this point, I'm going to say thank you so much and have a great evening.